Good day everyone. My name is Kylan A. Fernandez from BSc 1-9. So today I will discuss premenstrual syndrome and battered syndrome. So what is premenstrual syndrome? Premenstrual syndrome is a condition that affects women's physical health, emotion, and behavior during a certain day of the menstrual cycle, typically ending with onset of the menstrual flow. Estimated 3 of every menstruating woman have been experienced premenstrual syndrome. The true incidence of PMS has been often been overestimated, including all women who experience physical or emotional symptoms prior to menstruation. In addition, a more severe form of PMS, known as premenstrual lipopic disorder, it occurs in a smaller number of women and lead to significant loss of function because of unusual severe symptoms. Most women have at least one sign of PMS each month, but it's not the same for everyone. It can change as you get older. About 3% to 8% of women believe to have the condition. The most frequent physical related symptoms of PMS include fatigue, bloating, weight gain, breast tenderness, acne, sleep too much and too little, overeating. The most frequent food-related symptoms of PMS includes hunger and irritability, anxiety, tension, depression, crying, oversensitivity, and exaggerated mood. Each woman's symptoms are different and can vary from month to month. What can you do about PMS? Do regular exercise, eat healthy, balanced diet, get plenty of sleep, and try to reduce yourself by doing meditations. The most common symptoms of PMS includes mood swing, feeling upset, irritable, tardiness or trouble sleeping, bloating or tummy pain, headache, spotty skin, or greasy hair. The risk factor of premenstrual syndrome includes a history of depression or mood disorder, a family history of PMS, a family history of depression, domestic violence, substance abuse, physical and emotional trauma. So next is battered syndrome. Battered syndrome is alternatively referred as child physical abuse or non-accidental trauma, representing cause of morbidity and mortality during childhood. It is found in every level of society, although the incidence may be found in higher or lower income households. This number may be underestimated due to underreporting of the problem or failure of diagnosis by medical personnel. The total abuse rate of children is 25.2 per 1,000 children with physical abuse, accounting for 5.7 per 1,000 children. Sexual abuse 2.5 per 1,000 children. Emotional abuse 3.4 per 1,000 children. And neglect accounting for 15.9 per 1,000 children. These are all the possible results of battered child syndrome: internal injuries, cuts, burns, bruises, broken and fractured bones. Abused children may exhibit poor image, aggressive or illegal behavior, anger, rage, anxiety and fear, suicidal thoughts, sadness or depression, school problem or failure, nightmares, drug or alcohol abuse. Most of the time, the children knows the abuser well, or sometimes people who abuse children is being abused when they were children. Because adults are so much larger and stronger than children, unabused children can suffer severe injury or death without the abuser intentionally causing such an injury. Counseling and implementation of an intervention plan for the child's parent and guardian are necessary. The abused children is being removed from home to prevent further harm. Both physical and psychological treatment are often recommended as a treatment for abused child. Sometimes, emotional damage of an abused children does not appear until adolescence, when the abused children become abusing parents who may have trouble with physical closeness, intimacy, and trust. Psychological therapy is recommended as a treatment. PMS is a condition that affects a woman's emotion, physical health, and behavior during a certain day of menstrual cycle. The, the symptoms affect 90% of menstruating women. Level of estrogen and progesterone are increased during a PMS. Kaya sa mga katulad kong lalaki dyan, matuto tayong intindihin ang mga babae. Dahil hindi natin alam kung gaano kahirap yung mga pinagdadaanan nila. Battered child syndrome. The child who received repetitive physical injuries, which are as a result of non-accidental violence produced by parents or guardian.